infertility. The milkman, the paper boy, evening TV. Did I get delivered here? Somebody tell me, please. This whole world's confusing me. Clouds as mean as you've ever seen. Ain't a bird who knows you're true. Then a little voice inside you whispers, don't sell your dreams.
Good morning, Dr. P. We don't know what's going on. We have tried the basal body temperature that Nurse D told us about. I'm sure I did it right. You said whenever we see a dip in my temperature, that's a signal I'm ovulating, right?
Right?
Wait, yeah, like the song says. When I put my hand up on her hip. When she dip, I dip, we did.
Plus, I've been gaining weight. Missing periods. I have acne and hair all over my face.
Okay, how about this? I'll send you, Mr. McPuppet, for a semen analysis test.
Wait. What? A semen for what? The semen on this ship are just fine and all accounted for. Isn't that right, men? Aye, aye.
Well, we need to assess volume, concentration, motility, and shape to ensure they can make the trip to meet the egg. Mrs. McPuppet, we will need to run some tests with you as well. I'm going to do a complete physical exam and history for both of you. Mrs. McPuppet, I will be looking for any evidence of endocrine problems like bulging eyes, lid lag, tremor, or palpable thyroid gland. I also want to look in your eyes to see if there's any intracranial pressure. I will also do a pelvic exam and pap smear. During this exam, I will be assessing your uterus for shape and position. I will also check your cervix to ensure it's favorable for the sperm to pass through. The other things I will be looking for are signs of endometriosis, past injuries to your reproductive tract, and any signs of infection that might be preventing you from becoming pregnant. I will also do a hysterosalpingogram to take a look at your uterus and fallopian tubes to make sure that there is clear passage for the egg from the ovary to the uterus. I will instill a dye that's visible on X-ray into your uterus. This will tell me if there are any blockages or deformities. It may also flush open any blockages or adhesions. Mr. McPuppet, during your exam, I will be looking for any gynecomastia, vision problems, or abnormal hair patterns that might signify a hormonal problem. I will also perform a urologic exam to make sure your penis has the best structure and function for reproduction. Unfortunately for you, I also need to do a rectal exam to assess your prostate and plumbing to make sure they work as they should.
Gyno what? Rectal what?
I also want you both to have some lab work done. Nurse D, have them both scheduled for a CBC, urinalysis, RH factor, and blood group, as well as hormonal assays for FSH and LH.
Yes, doctor.
Also, for Mrs. McPuppet, have her scheduled for rubella immunity, TSH, prolactin levels, androstenedione, testosterone, and mid-luteal progesterone.
Yes, doctor.
All right, thank you. I have other patients to see.
Mr. McPuppet, for the semen collection, she just mentioned you have to abstain from ejaculation for 3 days and come back to our office to do the collection. Also, gynecomastia is a condition where men's breast tissue enlarges and if present means that there's a hormonal imbalance and there's a lot of estrogen in you. The other tests are mainly blood tests, hormone tests to check your levels, and then a urine test. Any other questions?
No, I think we'll try everything.
One quick question. Do you guys feel awkward about this? Because, I do.
So, welcome back. We have your test results. Mr. McPuppet, your sperm count is low. There are several things that can give you a low sperm count, like smoking, drinking alcohol, recreational drugs like weed, and over-the-counter drugs like anti-inflammatories. Do you use any of these?
Nope. Nope. Sorry. Okay. Well, when I'm hanging out with my friends and stuff, I might smoke and drink from time to time, but nothing big. Okay, all right, okay. Listen, a little bit of weed has not killed anybody.
Well, I strongly advise that you stop drinking and smoking, and we'll retest you in 90 days to see if your sperm count rises. Mrs. McPuppet, your hormonal assay test results confirm that you have PCOS, polycystic ovarian syndrome. You're producing too many androgenic hormones. I'm going to put you on Clomid. We can try that for up to 6 ovulation cycles, then we have to try something else. I have to take that phone call. I'll be back.
Nurse D, what is she talking about?
First, I'll tell you about Clomid. It works by stimulating your hypothalamus to increase production of FSH and LH, your female hormones that induce ovulation. The dose the doctor ordered for you is 50 milligrams by mouth on cycle days 5 to 9, and you should ovulate about 5 to 9 days after the last dose. Have sex every other day for 1 week. As far as side effects for Clomid, they include hot flashes, abdominal distension, breast discomfort, nausea and vomiting, vision problems, and headaches. So avoid bright lights. Any other questions?
None.
Okay. If you're sure this will work, I'll try it.
Okay. Take care.
Bye.
Hello, Mr. and Mrs. Poppet.
Yeah.
How has the treatment been going?
Hello. It's been very frustrating. I've never realized how much I hate swallowing pills. I've taken so many pills and nothing has happened. I've been following the regimen like you told me to. We have sex all the time.
All the time, huh?
Yeah. It's not even fun anymore. And all he does is cry about how tired he is.
I'm so tired.
And sometimes when I just sit around, I just get very hot and begin to sweat profusely. And I swear I'm starting to see some floaty spots before my eyes.
I'm so tired.
Okay. Everybody stop and take some nice and slow deep breaths. One more. I understand this is very stressful for you to go through, but please understand the stress can cause you to not get pregnant. You guys have to remember that even though conception is your goal here, you have to focus on your relationship. And doing this as an act of love to help you decrease the burden of conception. There are support groups you guys can seek out to see how other couples are dealing with these issues. Sometimes couples need counseling from a professional to deal with infertility. And if you like, I can have the doctor give you a referral to someone. Remember, your partner and your marriage comes first. The stronger your bond, communication with each other, and problem-solving skills, the better this will make this a smoother process. I'll go tell doctor you're here.
So, Nurse D tells me you're suffering with some of the side effects from the Clomid.
Yes, it's been 6 months and we haven't become pregnant. I think it would be a good idea if we try something else.
Well, your age makes you a candidate. Would you be interested in vitro fertilization?
I think I've heard of that. Honey, what do you think?
Sure. I don't have a problem with that. What's it all about?
I should warn you that IVF can be physically, emotionally, and financially challenging. It may take as many as 3 cycles of treatment to achieve a successful pregnancy. Mrs. McPuppet, you will have to have daily injections of a gonadotropin such as Brevel. This will stimulate the production of multiple follicles, which we will then have to harvest from your ovaries. During the Brevel therapy, you will have to have several ultrasound exams so we can monitor the number and size of the follicles. We also want to make sure we are not overstimulating the ovaries. In order to harvest the eggs, we will have you come in for an outpatient procedure where we will put you to sleep with IV sedation. I will then use ultrasound to guide me through your vagina to your ovaries, where I will retrieve the eggs with needle aspiration. This usually only takes about 30 minutes, and you will be sent home that day, but you should rest for 12 to 24 hours after the procedure. We will then fertilize the eggs and monitor them for normal embryo development in the lab. Once the embryos reach blastocyst stage, we will discuss implantation. Sometimes, couples have more than one viable embryo and wish to implant multiple embryos to increase their chances for a successful pregnancy. If the implantation is successful, you will have several blood tests and ultrasound exams to monitor the progression of the pregnancy. You may also be put on supplemental progesterone as a protective and supportive measure. Does this sound like something you're willing to do?
One.
At this point, we want something that can give us a strong chance of starting a family.
Yes, I agree with my wife. If you're saying that this is an opportunity for us to bring a little one into this world, I'll support my wife no matter what.
Okay, well, I must reiterate, this can be a very financially challenging situation. I believe we might be able to refer you to some financing help if you need, though.
Don't worry about it. I just won the Mega Million Powerball. Yeah, all right. How you doing, Nurse D?
Hi, welcome back, guys. You guys look so happy. Oh my gosh, is that little Junior I see?
Oh yes, it is. Isn't he just so adorable? I can't believe how much he has grown.
He's very cute.
My husband and I wanted to stop by and show him off to you guys.
Yeah, we're so grateful for the support that Nurse D and you too, Dr. P, for your recommendation and your patience with us.
You look so happy. It's been a pleasure helping you guys get pregnant. Thank you for allowing us to be a part of your lives. Congratulations.
Thank you.
Oh, and we also have a good news. We are pregnant.
Congrats!
Congratulations again.
Everywhere you look.
Alright, so
this goes out to all the women in the world, especially her. You know it don't even matter your age, don't even matter your